So the implant goes in your arm. It's like that thickness. Like
IUDs, implants, you can put them in and you can forget about them.
you're good for 7, 8, 10 years.
Do they look inside your vagina?
We use sometimes birth control just to treat things like
Now we have this T-shaped thing in the uterus. Can a partner feel it during sex? My name is Karishma. I'm a sexuality educator, and this is a series where we unlearn and relearn all those common myths, misconceptions, and questions which really should have been part of the talk. Hopefully we got it. Welcome to Talk You Never Got. Hello everyone, my name is Karishma and welcome to Talk You Never Got. Today we have Dr. Sehjal Bhargava. We're going to talk about IUDs, implants and other types of contraceptives or birth control that's often left out of the conversation. Before we start, I have an icebreaker question
oh my gosh.
for everyone who's come on the show. If sex were a food, what would it be and why?
Maybe a strawberry. Because like sometimes you just never really know what you're gonna get. Sometimes it can be like ripe and like tougher. Sometimes it can be, you know, a different shape, a different size, a different consistency.
I love that.
I think that relates to sex.
There's so much diversity in
Yeah.
strawberries. Who knew? Okay, awesome. Why don't we start with you tell us a little bit about yourself?
Sure. So I'm Dr. Sehjal Bhargava. I'm a family physician in Canada, and I'm doing additional training in public health and preventive medicine. And contraception and sexual health is one of my favorite topics to talk about. So thank you so much for having me. I'm excited.
Of course, and I can't wait to dive in. So, what is one time in your life that you've wished, damn, I wish that was in the talk you never got?
I feel like there are a lot of talks I didn't get because I didn't know what questions to ask maybe and who to talk to. When I was like, you know, a little bit older and like starting to explore things sexually, male pleasure and female pleasure and consent and so yeah, I feel like it's really great to start to address these things early on and have a trusted source, somebody you can ask these questions to, because I feel like they're, especially for women and women of color and people with uteruses, they're always just talks that you don't always have a chance to have before they become really important.
Well, we are here to change that today. And we're going to talk about LARCs, right? So what even is a LARC and why is it such a weird name? Can you explain it to us in simple terms?
It's exactly what it sounds like. It means that it's, you know, it's a one and done thing a lot of the time until you're ready to start preparing to have a baby or wanting to get pregnant. They're long acting, so they often can be in use in its, you know, the form that you get given for many, many years. They're reversible, which means that there's a really small time from having the contraceptive device inside or, you know, implanted or whatever it may be to removing it and then returning to fertility. So there's a really short time window and there's often not as many side effects as some of the other birth control options. And they're also great because they're often discreet, concealable.
What are we talking about?
What are we talking about? We're talking about IUDs and implants. So intrauterine devices they're a little device that are inserted. They fit in the palm of your hand. They're really actually quite cute. I've seen people make earrings and necklaces out of them. So there's hormonal and non-hormonal IUDs, and they're little T-shaped devices. They fit in the palm of your hand and they get inserted into the uterine cavity and then live there for the next few years. And then we have implants, and the brand name we have in Canada, which is where I practice, is called the Nexplanon, although there are different versions available.
Sorry, the implant is...
So the implant goes in your arm.
Oh,
yeah.
Okay.
So it actually fits, it's like a little, like picture honestly like a 0.7 mechanical pencil lead.
Oh, this is too specific.
It's like that thickness. Like it's
Like
really,
a thin pencil lead.
Yeah.
Okay.
But it's not the thinnest, it's a little bit thicker and it's a little flexible rod essentially. And we just use a little, like a little insertion device to pop it just underneath the skin of the arm. It can sit there for, I believe up to 3 years.
Oh, wow.
Yeah,
Okay.
or even longer in some cases, but evidence-based, we recommend 3 years to have it replaced. It's like a little nick in the skin, and then we put the device in, and then to get it out.
Okay. So both of these things, the IUD and the implant, they're things I would need to go to a doctor to get inserted inside me. And they're both really tiny, and they release hormones.
Good question. So there are many different kinds of hormones that are available in contraceptive options. And one type of IUD is a non-hormonal option. So that's the copper-containing IUD.
Oh, the copper T.
Yeah, the little copper teeth. And then there's a hormonal IUD, and then the implant does contain also a hormone. But these are progesterone-only hormonal devices, so there's no estrogen involved, which is another benefit for some people who can't tolerate estrogen for whatever reason.
Okay, gotcha. IUDs, implants, you can put them in and you can forget about them. One of these methods is usually birth control or preventing pregnancy. Is that the only reason one might want to get one of these?
So, birth control, preventing pregnancy, empowerment over your own reproduction. Whenever I talk about contraception, I like to also, for example, when I'm talking about a pill, for example, with a younger patient, I often call it like a period pill as well, which I think kind of destigmatizes and removes some of the thought processes that contraception is only for birth control. It actually has a lot of uses in women's health and people with uteruses health, where, you can have things like hormonal regulation, so it can help regulate periods. A lot of the hormone-containing options help with lighter periods, and an added benefit or a side effect of the medication, we say medically, is that you can have lighter, even reduced periods in some cases, or no period.
So we had a question about this from one of our viewers who said that, why don't we talk about the fact that some of these methods can actually remove our periods altogether? Yeah, could you talk more about that?
I think for a while, maybe women weren't talking about the impact that periods had on their life for a while, but now we understand that, missing work or missing school or having a lot of pain or having really heavy bleeding are not things that you need to tolerate just because you have a uterus. So you can actually use a lot of these hormonal birth control methods for period regulation. And they come in different doses, which is a conversation to have with your healthcare provider on what one works best for you in different sizes. But the one that's the highest dose that's available is the Mirena IUD. And there's a 20% rate of having no period within 1 year of insertion. And then often with that, your periods do become lighter, but important to note, in the IUD option, the intrauterine device, you are still ovulating. So there's a different method of birth control.
Even with the hormonal one?
Yeah, you still ovulate.
Interesting. And so is there a risk of pregnancy associated with that?
So the reason we recommend these long-acting reversible contraceptions is because they're so easy to use. You have it inserted, you forget about it. And they're really effective at preventing pregnancy because there's very little user error, obviously.
How effective?
With the hormonal IUD, it's like less than 0.05% risk of pregnancy.
Wow, really low.
In 1,000 women years. Yeah, actually the most effective is the implant, which is very interesting because that actually does suppress ovulation. So the important caveat with the IUDs, and this goes for the hormonal and the non-hormonal, the copper IUD, is that in the very rare occasion that you do get pregnant, there is an increased risk of that pregnancy being an ectopic pregnancy, which is a pregnancy that's outside of the uterus, so on the fallopian tube, typically. That's an indication for an abortion. Those pregnancies can't be carried to term because they're not in the right home. And so if you do have a positive pregnancy test on an IUD, that's a reason to go see a doctor.
But this happens 0.05%.
Yeah, it's very, cases. In the chance that you get pregnant, which is extremely small, you have a higher risk of having an ectopic pregnancy.
Got it.
Which is part of the conversation we have about, the risks and benefits of some of these contraception options.
Can you walk me through, let's say I want to get an IUD, I go to my doctor. Is it just any random day that I go? What do they do?
Yeah, so you go to your doctor, you say, my periods are really heavy, I'm having really bad, pelvic pain, or I have to miss work because of my periods. They're irregular also, could be another reason, I'm bleeding intermittently and spotting. We'll obviously do a medical workup to make sure that there's no underlying reason for any of your concerns. If you're not on birth control, that's probably the next place the conversation goes. So you talk about the different options that are available to you. And a lot of these are, they're all prescription medications. So you get a prescription, you go to the pharmacy, you pick up the box that has your IUD in it. And it's like a little cardboard box.
Where is this? In Canada?
Yeah.
I would imagine this is a bit different in India.
Sure.
It's possible that I've not done it myself, but I think the medical provider procures it.
Okay, interesting. Yeah, so it depends on your health system.
Don't quote me on that.
Yeah. So, but it is a prescription. Whoever supplies it, and then you talk to your provider about when the appropriate time is to have it in place, inserted or implanted, and then you go from there. And there are some myths around timing of birth control, but I feel like the best time is the most convenient time, the time that works for you. Some doctors and some practitioners say it's easier to insert the IUD around the time of someone's menstrual period because the os, the little hole in your cervix that you bleed out of, is a little bit open, which is true. It can reduce pain in some women. Not all women find it to be less painful on their periods.
So you put it in a stick?
Yeah, let's talk about it. I wish I had a model. So the IUD itself, like I said, it fits in the palm of your hand. It can dangle on an earring. It can be a necklace. And it comes folded up in a little device. And then when it deploys, it gets its like T shape.
Okay.
So
it's not going in the T shape.
No, it goes in all nice and folded up. And then it opens up to fit your uterus once it's in the uterus. You know, when we talk about nervousness around insertion of some of these, which is maybe one of the bigger barriers, is, you know, having somebody explain the process to you or watching a video online about what it looks like can be really great ways to ease some of that anxiety. So the process is, you know, you come in, you know, we talk about things. There's a pelvic exam that typically happens so that we can determine where your uterus is, whether it's flipped up or down.
What happens? Like, what does that mean? Do they look inside your vagina? Okay.
No, I'm totally kidding. It's just a digital exam, so we just use our fingers.
And not devices.
No, there's no speculum involved at that point. But we do use a speculum when we're inserting the IUD. So you'll often have a finger in your vagina and then a hand pressing on your abdomen so that we can feel the shape of your uterus so we know where we're going to implant the IUD. You know, medications beforehand are a really important part.
For pain?
For pain management, for cramping, for anxiety. So, like, if a patient was really anxious about things, I would have no problem prescribing them maybe like a low-dose Ativan, like a one-time use thing. You know, so it's like the way we might prescribe a benzodiazepine for, you know, anxiety around flying or getting medical imaging done. And then taking an NSAID, a non-steroidal anti-inflammatory like ibuprofen, is really helpful for uterus-specific pain. So those are some things you could do in advance. You know, loosening up, having a support person there can be really helpful. Relaxing music is a good thing during. And then you can always ask your provider about pain control during the procedure, which is something that I don't think a lot of practitioners, there are like often local anesthetic options that we can use either like just in the area. So like a spray, we can do nerve blocks even sometimes if people know how to do that.
How much does it hurt?
It's person specific. A lot of women, sometimes they're just like, oh, that was fine.
It didn't hurt?
No. Oh. Some people are like, that was worse than having my baby, which are
Uncommon.
Yeah,
okay, good.
Uncommon. But the positive thing is that it's a short procedure. It takes maybe 10 minutes total.
And then you're good for a few years?
Oh, you're good for 7, 8, 10 years.
Wow. That's a long time.
It's awesome. And then you even think about the cost of the device. It's extremely cost effective.
It depends where you are, I'm
Depends
sure.
on where you are. Yeah. But, you know, often there's a cost to these IUDs. And when you divide it by 8 years, it's pretty cheap.
I see. Let's say we've done the procedure and moved on. Now we have this T-shaped thing in the uterus. Yeah. Can a partner feel it during sex?
Yeah, really good question. So the last part of the insertion is us trimming the strings.
There's a string.
There are strings. They look like little flosses. Like there's 2 little flossy strings kind of hanging down. And that's also for us to be able to remove it quite easily. The strings are an important part, but they're not the whole thing. You know, the strings can signal that the IUD is in place. If they get really long, like all of a sudden, if they get much longer, you could say maybe my IUD is moving around and I should get an ultrasound. If they disappear, it could be that they got sucked up by your uterus and maybe you just get an ultrasound to double check. But it's a really great insurance policy just to feel like the strings are there and you're like, I know my IUD is still there. The great thing about these strings is that they soften over time.
Oh, they soften.
Yeah, and then they end up kind of just like curving around the wall of your cervix and your vaginal wall. So yeah, you may feel the strings, but they do soften over time and you can always get them trimmed. Your option. Yeah.
Cool. And then the other question we got from one of our viewers is, my friend's IUD came off while she used a menstrual cup. Is it advisable to get an IUD while you're using a menstrual cup?
So like when you think of an IUD, it lives in your uterus, but there are those strings and those strings are how we remove it. So if those strings get caught on anything, for example, a menstrual cup where there's like a bit of a vacuum effect of the menstrual cup in your vagina collecting, your period products. If it were to get caught when you were to take out the menstrual cup, if it gets caught in the suction effect, there's a risk of dislodging or even removing the IUD. So, there are measures to take, like making sure that vacuum seal is broken before you remove it, making sure that your strings are short. So you can, but I could see how it could maybe be a bit of an issue. So be advised.
Okay, but other forms are okay, like a disc or a tampon?
Like I said, those strings are there, so there's always that little risk of them getting dislodged, but most women use tampons with no problem.
Okay, we've not really talked that much about the implant. Tell us about what are some of the benefits, what are some of the downsides of the implant?
Yeah, so the implant is another form of the long-acting reversible contraception. It lives in your arm, and like we said, it's like a little rod that's implanted just beneath the skin. So you should be able to feel it in your arm the whole time you have it, but it's very discreet, and typically if you don't know what's there, you wouldn't be able to find it. The way that it works is that it sends progesterone through your whole body, and it actually inhibits ovulation. So this one actually stops you from ovulating, and it lasts for up to 3 years before you have to get it replaced. And it's estrogen free, which is great for women who have some of those risk factors that, you have to stay away from estrogen. For example, breast cancer, pastor, or active, migraine with aura, for example, and other risk factors that you should discuss.
What are some downsides?
So it's actually one of the best forms of contraception. It's even more effective than the IUD. But the downside is that because it lives in the skin and not in the uterus, there are a bit more system-wide side effects. So some people get, headaches, breast tenderness. Some people have, they perceive mood changes. Some people perceive weight gain or weight loss even. And then the biggest side effect and the number one reason why people say I don't like this form of contraception is typically the bleeding. So there is a risk, and same with the IUD. There's a risk of, bleeding and irregular menstrual bleeding and spotting, for example, or irregular periods for the first 6 months while your body gets used.
6 months? Oh,
yeah,
no.
while your body gets used to it. Typically, the experience is a lot shorter than that of the irregularity or the spotting.
One last question that I have is, I think when people think about these, especially hormonal birth control options, there's a lot of worry about side effects. And I think more and more people with uteruses are coming out talking about how a lot of these hormonal interventions have huge mental health downsides. So what are your thoughts on that, especially with these two methods that we're discussing today, of the IUD and the implant?
Yeah, really valid. So typically, the IUDs will have less of a side effect profile than the implant because the IUDs work locally in your uterus. So it's really only working on, the uterine lining and the cervical mucus, like it's causing these changes just in the little area of the uterus. Versus the implant, the pill, the shot, other forms of contraception we didn't really cover today, do have more system-wide effects. And some people do definitely have mental health impacts. And, we use sometimes birth control and contraceptions to treat things like premenstrual, mood disorders, for example. But at times, yeah, of course it's a hormone. So, everybody responds differently. I would always say try it and see how you respond and watch yourself closely, make a journal of symptoms so you're able to advocate for yourself in your follow-up appointments. And then, yeah, your practitioner should definitely keep those things in mind because you know your body best. So
I've definitely had a physician tell me that an IUD can cause infertility, which is not true, right? No. Yeah.
I would just say, equip yourself to be able to advocate for yourself for whatever you're feeling. And there are many, many options available. One of my favorite resources that I will highlight is called Secks and You. It's a website. So secks and then just the letter u.com or .ca. It's a really just great, evidence-based resource that's really easy to navigate and very, very person-friendly to use.
Yeah. I also really love findmymethod.org.
Oh, yeah.
So that website has all the different types of birth control, but it also lets you compare them side by side. And it lets you filter by country to see pricing and stuff in your country and context. So, okay, that brings me to our rapid fire. We're going to do this really quickly. Give me the quickest answer that you can. What's the most misunderstood form of birth control?
Hormonal IUDs, and people thinking that, the hormones impact your whole body when they really just act locally.
Okay. What kind of birth control are you on?
I'm on a anti-androgen birth control pill called Yaz.
Cool. I took Yaz for a bit too. What's a myth you've heard about birth control?
That it will cause weight gain, and it can. Which is, I guess, it's kind of a fact, but I would say try it.
But it doesn't for everyone.
Doesn't for everyone, and you won't know until you try.
Okay, cool. What's one thing every patient should ask their provider during a birth control conversation?
I don't know. I think it depends on where your concerns are, but side effects is really a good thing to know. When to stop in case you want to have a baby. Some contraceptive options, like the shot, especially the Depo-Provera shot, take some time for your cycle to return back to regular. But an IUD, you can just yank. A birth control, you can just stop.
Yank, don't say that.
You can gently pull. My bad. You can gently
Okay.
remove from the uterine cavity and have a baby the next week even.
Oh, wow. Okay, cool. And if you could get one birth control PSA to go viral, what would it say?
That birth control is for a lot more things than birth control. I like to call them period pills. I like to call them, all different kinds of words because I think it removes some of the stigma, especially around our younger users who, aren't yet sexually active but might be thinking of being sexually active. It gives you a tool to advocate for yourself and be like, I have really bad acne. I have really painful periods. I have really heavy bleeding, that my periods are irregular. And, those are all reasons that you could explore a conversation about birth control with your healthcare practitioner.
All right. Well, that brings us to the
That
end
was
of this
fun.
conversation. Thank you so much for being here today. And for all of those who are listening, please stay tuned. We have so many more episodes coming in this series. Please don't forget to like, follow, subscribe, do all the things, press all the buttons, because we want to keep bringing you some more and more sex ed content to fill in the talk you never got. This feel bad just saying it. You will regret your abortion someday.
Regret, I think, is a valid emotion that we could feel about any decision, and doesn't mean that, you can feel it temporarily as well. So I think it's all really about you.